So how are we going to treat thyroid? Need to be on the right vitamins. The vitamin D has been getting a lot of good press lately. 9 years ago, when I started in the full practice of alternative medicine, nobody was saying anything about vitamin D, and we had 400 international units of vitamin D in the multivitamin, and we thought that was plenty. Now, in the last 5 years, an immense amount of research has been released, has been done, and we now are very aggressive at getting these levels into the 50s and 60s, and even now 70s, and we're even now pushing up to 90, especially for cancer protection risk. But helps the thyroid gland too. Minerals, selenium, zinc, iodine. Most of us are iodine deficient. Unfortunately, just because we're iodine deficient, that doesn't mean we're not making enough thyroid hormone. When I first started treating more adults, I'm a pediatrician by basic training. So coming here to alternative medicine, I had to learn two things. One was I had to learn alternative medicine, the philosophies that are different and how they work and all the stuff that we do. But second, I had to learn how to be an adult doctor. Two different tracks. I had to learn that we needed all these vitamins and minerals, because before I wasn't really convinced that we needed them. But we do need them because the iodine deficiency is rampant. We have an iodine deficiency throughout the United States. When I first came to alternative medicine, I learned how to use thyroid hormone. And it seemed like there were an awful lot of people that needed to be on thyroid hormone. I get the levels, and after a couple of years of doing this and putting people on thyroid hormone, and the massive number of people on thyroid hormone, I felt this was just too much. There has to be something wrong. There has to be a better way. So for about 2 years, I was very aggressive with giving iodine, giving some other substances that we're going to talk about, making sure everything is fixed for iodine or for the thyroid hormone to function. And then I discovered after a couple years that almost everybody that I used to put on thyroid hormone, I was still putting on thyroid hormone. That the iodine deficiency, even though it was present, usually wasn't the reason why this hypothyroid state was there. Essential fatty acids, both the omega-3s and the omega-6s, we have to have the nutrients if we're going to have the thyroid working. DHEA and cortisol, these are the adrenal hormones. We need to, if we're stressed all the time, we need to learn how to de-stress. We've done some exercises in here, holding our fingers, walking through breathing. Yoga, exercise can be a de-stress, or it can make stress worse. We need to find the things, find what we need to be doing in life, finding our purpose and our mission so that we can de-stress, remove toxic metals. We're very aggressive with that in our office. Cadmium, lead, chemicals, chelation. The sauna is probably one of the best ways to get the general toxins out of our body. The sweat, so if you exercise and you sweat, then you're going to get the toxins out. Saunas do that very effectively. Correct low serotonin, if it's there, there is a urine test that we can test for to see what the serotonin levels are doing based on the excretion out of the urine. Reduce the stress, we've talked about that, avoid soy alcohol. There are certain medications that interfere. We try to get everybody off of all medications if we can. For the most part, there are alternatives to most of the medications. We just need to fix the underlying cause rather than treat the symptoms. If Hashimoto's, it's an autoimmune disease. A lot of people with Hashimoto's will also have celiac disease, another autoimmune disease. So it needs to be checked for if an autoimmune disease is present, and we use what's called low-dose naltrexone, which is an immunomodulator at the low doses that we use, trying to build and help the immune system. We typically use the crude extract of the thyroid hormone. Question?
What is celiac disease?
Celiac disease is a gluten sensitivity, gluten intolerance. And the body has decided that gluten is the enemy, so every time you take gluten in, and gluten is just from the wheat. It's from 5 different grains, but mainly in the wheat. So when you take that grain in, which we should not be allergic to, they are allergic, they're sensitive to it, so the whole GI tract reacts to that gluten. And then you have the diarrhea, the constipation, the bloating, the pain, the cramping, all of that. We use the crude extract. Nature-Throid, Armour-Thyroid, West-Throid are the 3 crude extracts. They actually come from a thyroid gland. They contain T3, T4 in about the ratio that we have in our body, and also contain T1 and T2. What kind of laboratory evaluation? The TSH, T4, T3. Now in allopathic medicine, a lot of times they just get a TSH level. All you've done is check to see what the stimulus from the pituitary to the thyroid is. There is no way to know what the thyroid hormone is doing in the body with just a TSH level. I think that is woefully inadequate. So T4, T3, and sometimes a reverse T3 just to see if there's something weird going on. DHEA levels and cortisol levels can both be measured. Vitamin D levels, toxic metals can be evaluated with hair and urine analyses, and the urine test for neurotransmitters. So that is the simplified version of the thyroid gland. Okay?